Welcome back. The holidays are the time for dinner parties and celebrations, but doctors also see more people with symptoms of food allergies. Joining us now live in the studio is Dr. Sudip Bose with Medical Center Hospital. Doctor, thank you for joining us today. Now, explain, why is this that we see this increase?
Well, thanks for having me. Looking forward to Thanksgiving. Hope everyone out there has a great Thanksgiving. But this is a time we see more food allergies. You know, most of us can just go to the table on Thanksgiving Day and eat without thinking twice. But for the 15 million people out there with food allergies, 4% of adults, 8% of children, they have to respect every bite. They have to think before everything they eat. And this is a time of year when we're eating different foods, we're eating them in different environments, and they're prepared differently. So we have to be more careful. That gravy at grandma's house may not be the same as the gravy we have at home. So we've got to be more careful.
Of course. And what are common allergies that we see this time of year?
Common allergies can range. I mean, the number one allergy is milk allergy or lactose intolerance, and those cause kind of stomach indigestion, discomfort. And then the more serious allergies, the ones that can be life-threatening, can be shellfish, peanuts, or eggs, and those can range from minor hives to more severe symptoms where the lips and tongue swell, and it's a lot more serious.
Got it. And so what can people do? I know this, I mean, really, you kind of have to take this as a responsibility on yourself and ask the questions, I'm sure, of how people are preparing their food. How can people protect themselves when they go out to these parties?
I think the main thing here is an ounce of prevention is a pound of cure. So there is no cure for food allergies. You have to prevent it. Be knowledgeable. Be knowledgeable about how that food is prepared. Be knowledgeable about what is in the food. You may want to make the person who's preparing the food aware of your allergies. And the other point I'd make is you cannot be allergic to something your entire life and then all of a sudden become allergic to it. So just be aware. One thing we see in the emergency room is, you know, besides those kind of dangerous cases where, you know, the lips, tongue, and airway are swelling up, are just kind of undiagnosed food allergies where, you know, why is that patient having increased asthma symptoms? Why do they have that rash? Why are their migraines flaring up? And these are things to just keep an eye on.
Right, and if you're cooking the meal, maybe it would be beneficial to ask your guests if they do have any allergies.
Correct, correct, because it only takes a small amount of the allergen. I mean, you know, if it's on a surface or you don't wash your hands properly, that little amount, if someone has like a severe peanut allergy, for example, can really make a difference.
Right, so, and if you do get this allergy or experience something like this, 911 or just go to the hospital, call your doctor, what will you recommend?
I mean, if you are in that unfortunate predicament where your mouth is swelling, your lips are swelling, you feel like your airway's closing up, I would suggest taking a Benadryl if you have one around you and seeking help in the emergency room as quickly as you can. If you're having more minor symptoms like kind of the bloating, indigestion, kind of the hidden allergies, you know, 2 to 5% of these severe ones, 60% of these hidden allergy symptoms, those are ones that can be worked up outpatient as a doctor.
Dr. Sudip Bose, Medical Center Hospital, thank you so much for joining us today.
Thank you for having me. Happy Thanksgiving.